Hello guys, I'm Dr. Harsh Manadkar and let's learn today about malignant melanoma. So in order to learn what is malignant melanoma, we have to remember one mnemonic, one entire phrase, that is because Salman shot buck, Supreme Court bans him from learning ABCDE. Okay, so what do we know? So because Salman Khan shot buck, Supreme Court bans him from learning ABCDE. Okay, so to begin with, what is malignant melanoma? Malignant melanoma is a malignancy of melanocytes. Okay, the cells which are present in our body is called as melanocytes. So now we look at the pathophysiology of it. It is said that 9q21 chromosome, if there is any aberrations in this chromosome, we see malignant melanoma. Also, there are different genes which are involved, which are CDKN2A, CDK4 and CDK2A. Okay, remember it is CDKN2A, CDK2A and CDK4. Okay, these are the genes which are involved. Then looking at the phases, fine. Malignant melanoma has two phases. Also remember, it is malignant melanoma starts with M and N. So it is most common in males. Okay, it is most common in males. Then it has two phases. One is vertical phase and what is horizontal phase, which is radial phase, also known as radial phase. So what exactly does it mean? This is the skin which is on which the malignant melanoma is taking place, and this is the epidermis, this is the dermis, and this is subcute. So in horizontal it will move in this manner, okay, but in vertical phase it will move in vertical manner. Fine. Then moving on to the clinical features, we need to remember what are the types by this mnemonic, which is Salman. S stands for superficial spreading. We'll enumerate all first. A stands for acral lentiginous. L stands for lentigo maligna. M stands for mucosal lentiginous. A stands for amelanotic. N stands for nodular. Okay, so superficial spreading is the most common one, and it is seen in sun exposed areas. Remember, S for sun, and sun is the is the most common. Imagine like that, and then it is seen which is most common. If they ask you which is most aggressive, A starts with aggressive. Aggressive starts with A, and acral lentiginous also starts with A, so it is most aggressive. Okay, lentigo maligna, which we see, it is seen on the face where there is something called as melanotic freckles of Hutchinson's. Okay, you see these freckles like this on the malar area. These are the melanotic freckles of Hutchinson. Also comment below where do you see Hutchinson's sign and where do you see Hutchinson's incisors. Okay, this becomes your lentiginous lentigo maligna. Mucosal lentiginous, it is found in the mucosal areas such as respiratory, GIT, vaginal tract, reproductive tracts, etc. Then amelanotic is erythematous. If the MCQ is asked which is the only erythematous, then it is amelanotic. And nodular. There is a funny fact about, not funny, there is an important fact about nodular type of malignant melanoma is that it has only vertical phase. That is only vertical phase. That is how you remember is N. You can remember N like this. Okay, the nodular is the one which has only vertical phase. In oral manifestations, the sites which are most common, like from most common to least common, I'll tell you. First is palate. Okay, then comes maxillary, gingiva, and then comes alveolar ridge. Okay, these are the most common sites in this order itself, and it is asked in exams about these orders. Okay, then the second thing which we learned was short bug. So what is short bug? In histopathology, when we take a sample, when we take the specimen of the malignant melanoma and look it under the microscope, we find that something called as pagetoid scatter of melanocytes. Okay, pagetoid scatter, which is also called as buckshot scatter. which is also called as buckshot scatter, which resembles buckshot scatter. Okay, then in immunohistochemistry, it shows positive for S100, HMB, HMB45, and it is also vimentin positive. Okay, these are immunohistochemistry chemical studies. Then what does BAN stands for? BAN stands for, it tells about most common sites where malignant melanoma occurs. It is B stands for back, A stands for arms, N stands for neck, and S stands for scalp. Okay. Then moving on to the ABCD rule. ABCD rule, why it is given? So how will you differentiate between mole and malignant melanoma? So if it is malignant melanoma if the lesion is asymmetrical, or if there are border irregularities, if there are color irregularities, if there is larger diameter, that is more than 6 cm, and E is for evolution or evolving. So what does it mean? If this is a mole and this is malignant melanoma, okay, lesion, then this will be completely symmetrical, but this will be like asymmetrical. Can you see the asymmetry? Then this first, then second border irregularities, how it is even, it will be irregular borders. Then color differences, it will be homogeneously brown, it will be brown, black, even might be somewhere in between erythematous area. So then diameter here lesser if it is more than 6 centimeters. And then evolution, if there is this lesion is only one, but over a period of time it changes to multiple lesions at same point, or it becomes smaller, it becomes bigger, or it was smaller, it was homogeneous color, it changes color to something else. So this is for differentiating between mole and malignant melanoma. Then moving on to the class 5 rules. So we learned about Salman, buckshot, scatter, Barnes and ABCD cell. Then we move on to class 5 levels. So what are class 5 levels? It's basically to determine up to what level the malignant melanoma has gone to and what is the prognosis of it. There are 5 levels: level 1, level 2, level 3, level 4 and level 5. So you have to remember this by this diagram. This is the epidermis, okay, this is your dermis, and this is your subcute fat. Subcute fat, dermis, epidermis. Okay, in epidermis itself we have papillary layer, right? Papillary layer and reticular layer. So level 1 is up to dermis, epidermis, up to epidermis, entirely epidermis. This is level 1. Then second is extending into papillary layer, but not impinging on the reticular layer. So this becomes 2. Then third is impinging on reticular layer, extending into reticular layer is 4, and completely into subcute fat is level 5. Now we will talk about survival rate, because the MCQs are asked on this. That level 1 is survival rate of 100 to 98%, 5-year survival rate. 5-year survival rate, it is 100. Level 1 is 100 to 98%. Level 2 is 96 to 74%. Level 3 is 90 to 46%. Level 4 is 67 to 31%. And level 5 is 48 to 12%. Okay, I have to look in my book for this because I can't remember these percentages. Okay, so these are all 5-year survival rates according to this. So how do you know up to which level it has gone? What is okay? There's another concept called as Braslow's thickness. Okay, Braslow's thickness. It says that less than 0.75 mm is the thickness of the lesion. Then it is there are very less chances of mets, that is metastasis. Okay, and how do you think they record this How do you think they evaluate this? It is done by ocular microscopes. This is another MCQ question wherein they use ocular microscopes. To sum up, this is your malignant melanoma. Thank you.